Postpartum recovery. The first 6 weeks after giving birth are known as the postpartum period. This period is an intense and critical time that requires all sorts of care for you and your baby. During this time, which can actually last up to 6 months, your body will experience a number of changes from hormonal mood swings to healing after childbirth. Postpartum recovery doesn't happen overnight. Having a baby is one of the most memorable experiences a mother will ever go through. The excitement of bringing your bundle of joy home aside, it can be easy to forget that your body has just endured 9 months of physical and emotional changes, and it may take weeks or even months for you to return to your pre-pregnancy self. An overall feeling of vaginal soreness and bleeding is normal. To give you a better insight, we've highlighted what you can expect during your postpartum period. 1 week postpartum. You've just given birth, and you may have a hard time adjusting to your post-baby body as your uterus begins to contract back to its usual size. It's not uncommon for you to experience varying levels of discomfort after a vaginal birth. You'll also probably feel little contractions, especially when breastfeeding. As weird as it feels, this is just the uterus contracting back to its pre-pregnancy size. Taking a warm sitz bath, or applying some ice packs will help to soothe the pain. You may also want to avoid long periods of standing or sitting. If you had a C-section, you may have difficulty moving around as your body is still healing from a major abdominal surgery. A lot of women have trouble getting in and out of bed, but it's important that once you're feeling better to try getting up and walking around to avoid blood clots and swelling in your legs. This helps to improve circulation and promote healthy bowel function. Keeping your incision dry and clean is especially important as it helps to prevent infection and scarring. To care for your scar, gently cleanse it with soap and water before patting it dry. Beyond the physical changes, you're also likely to have fluctuating hormone levels. Your estrogen and progesterone levels are dropping. Moms who are choosing to breastfeed may also experience engorgement and a rise and fall of your prolactin and oxytocin levels. 2 weeks postpartum. At this point, some women may still experience vaginal bleeding and occasional discharge, but the bleeding shouldn't be heavy. This usually lasts for around 6 to 8 weeks, but it should start to taper off from the 2nd week onwards. Your wound may also start to get a little itchy, but don't worry. This is completely normal and part of the healing process. There are some women who may also have postpartum constipation after giving birth. Staying hydrated and consuming a fiber-rich diet of whole grains, fresh fruits and vegetables will help to get your bowel movements back on track in no time. By now, you should be able to resume day-to-day activities and light exercise such as walking and stretching without much trouble. Just make sure to take things slow and get ample rest when needed. If you're still feeling achy, try a hot shower. 3 to 6 weeks postpartum. It seems like you're recovering well. This is when the uterus goes back to your pre-pregnancy size, and the bleeding stops, although there's a chance that it may start up again. At about 6 weeks, most women are cleared for exercise and sexual activity, but don't feel pressured to be intimate if you don't feel fully ready for it. Instead, you can focus on healing and connecting with your partner in other ways such as touching and cuddling. Take your time to ease yourself back into a fitness routine and go easy on the more intense workouts. Keeping up with your postnatal appointments are important as it ensures that you're healing properly. 6 months postpartum. If your hair was falling out after your delivery, it should stop now. If you have been experiencing urinary incontinence, you should have full control over your bladder again. For most women, your period may come back anytime now. Those who aren't breastfeeding usually get it within the first 6 to 12 weeks, but most nursing mothers will find that their period can be delayed for several months. This is because the hormone that is needed for milk production actually suppresses ovulation and prevents you from having a period. However, keep in mind that breastfeeding doesn't protect you from conceiving and it's possible to ovulate before menstruating. Hence, it's wise to discuss birth control options with your doctor if you're concerned about an unwanted pregnancy. Most importantly, remember that every woman's recovery journey is different, so give yourself all the time it needs to heal and allow yourself to celebrate your postpartum body. Welcome to motherhood. Hey, so tell us how your postpartum recovery went in the comments section below. And thanks for watching Tiny Tribe Parents. If you could please help us out by hitting the like button, comment and subscribe to our channel for more incredible content that is on the way.